Our course design as a treatment for PSA is based on the work of James McCroskey, who tested forms of treatment including systematic desensitization, meaning simply having students use relaxation techniques such as deep breathing and visualization while they were visualizing giving speeches and while they were actually engaging in giving speeches. He also used videotaped speeches and had students watch their own speeches to try to desensitize them, and cognitive restructuring, or just giving students new ways to think about the fear of public speaking. Since then, a lot of scholars have found that a speech course designed to infuse a three-pronged approach to treatment, including graduated exposure therapy, cognitive modification, and skills training, provides the most effective relief for students' PSA. South Dakota State University's course includes such a three-pronged approach. Our course design begins with a very simple speech, and then it stacks speeches of increasing difficulty as the semester progresses and student learning and experience increases. Our course design also relies on strong training for our instructors, most of whom are graduate teaching assistants. Instructors are taught how to give effective feedback, telling a student about at least one or two strengths of his or her speech for every weakness mentioned. For more details about our instructor training or about our course design, please see our manuscript submitted for this conference and some of the links therein. We have been enthusiastic to find semester after semester that we have had measurable and statistically significant PSA reduction for our students, and we've had a chance to document that in multiple studies. In 2014, we found that our students' mean score of 102.19 in the post-test was significantly lower than the pretest mean of 114.83, a statistically significant difference at the level of 0.001. And then in 2015, we tested the differences in the means of PRPSA for our students at the beginning and the end of our online courses, and also found a significant reduction in our students' PRPSA scores. Using the PRPSA not only to measure our course's effectiveness in helping our students, but also for assessment, which has become a much more important topic in the United States, has helped to satisfy our administration's demands to know measurable outcomes of our course designs. McCroskey in 2007 said, "It is important that we recognize that developing assessment programs is much more difficult for some departments and faculty members than others. That's why our 2014 publication was actually geared toward using our course design and our assessment design as a model for institutions that were new to the idea of academic assessment. The PRPSA meets the three criteria for assessment measures set forth by Benjamin et al. In 2009 in the Council for Aid to Education. And as a result of our assessment, we've received support financially and resources for a speech communications center, or otherwise known as a speech lab, to aid students in further PSA reduction and to help us continue to research the best practices toward that end."